Hi, everyone, and welcome to PRISM. Okay, welcome to PRISM's webinar, a treatment for nighttime sleep disturbances in SMS. My name is Allison Stefanok, and I'm a PRISM's board member, and I'm also a mom to an incredible 12-year-old daughter with Smith-Magenis syndrome. This webinar is brought to you by PRISMS. PRISMS is an acronym for parents and researchers interested in Smith-Magenis syndrome. PRISMS is an advocacy, education, and support organization for individuals with SMS, their families, and the professionals who serve them. Information contained in this webinar is intended for your general education and information. PRISMS webinars are not intended, nor do they constitute medical or other advice. Viewers are warned not to take any action with regard to treatment based on this information without first consulting their physician. A recording of this webinar and all past webinars can be found on prisms.org under the Education tab. If you have any questions for our speakers during the webinar, you can type them into the Q&A section at the bottom of the screen. At the end of the presentation, we will take some time to answer as many questions as we can. So tonight, we will be talking to Vanda Pharmaceuticals about the first medication FDA approved to treat Smith-Magenis syndrome. Joining us is Mallory Mayo, Senior Director of the Medical Affairs Department at Vanda. She has a doctorate in neuroscience and a master's degree in clinical psychology and education. Her team works to provide scientific information and support to researchers, healthcare providers, as well as helping to support the needs of patients and their families. Frances Fritz, who is the Director of Health, Education, and Advocacy at Vanda, is also joining us. She has a degree in nursing and health sciences. She oversees many of the patient-facing resources at Vanda. And we also have joining us Sam Nash, Senior Manager of Case Management. She has an undergraduate degree in public health and a master's in social work. She has been working directly with patients and their families with Vanda for the last 6.5 years. Thank you, Mallory, Frances, and Sam, so much for joining us this evening and for sharing this exciting information with our community. Sleep disturbances are an incredibly challenging aspect of Smith-Magenis syndrome, so I know we are all looking forward to hearing about a treatment option. And with that, I'll turn it over to you now.
All right. Thank you so much, Allison, and good evening, everyone. Again, my name is Frances Fritz with Vanda Pharmaceuticals. Thank you for joining our webinar. It's such a pleasure to have you here with us. Again, I'll be leading our session alongside my colleagues, Dr. Mallory Mayo and Ms. Samantha Nash. And what we'll be speaking about is Hetlios, or tasimelteon, a treatment for nighttime sleep disturbances in SMS. This session will be an introduction to the medication itself, Hetlios, and the insurance process, so how to get Hetlios through your insurance company. We'll provide about a 20 to 25-minute overview, and then we'll hold at the end to welcome questions through the Q&A portion of the Zoom session. And we hope you leave our session tonight with the tools and resources you need to understand if Hetlios is right for your child. But we do recognize this session is just that. It's just an overview or an introduction. So we'll also discuss our patient support team called Case Management here at Vanda. Our case management team is available via phone to help provide additional educational information, provide additional information to your healthcare provider, and more. But before we go any further, I'd like to reintroduce ourselves, make sure we reintroduce my colleagues fully. Again, my name is Frances. My background is in nursing. I've been with Vanda now for almost 9 years, working alongside our case management and our nurse educator teams, who are the patient-facing resources to the communities that we serve. Mallory, would you like to introduce yourself now?
Sure. Hello, everyone. Good evening. My name is Mallory. I lead the Medical Affairs Department at Vanda, where we respond to questions from healthcare providers, but also patients and their families. And as was mentioned, I'm a neuroscientist. That's my primary background, but I also have worked in clinical psychology and education, which has been really a helpful tool to have. Like Frances, I've worked with Vanda for going on 9 years, and I'm really looking forward to hearing from you. I'm going to talk a little bit, but I'm looking forward to hearing from you later on.
And Sam, would you like to introduce yourself?
Yes, hey everybody, I'm Sam or Samantha, whatever you prefer. Like Allison mentioned, I'm one of the senior managers of the case management team. You might also see the term health educator. It's the same thing. And my background is in public health as well as social work. So I've definitely always had a strong interest in health education and working with patients. And I've been with Vanda for about 6.5 years now. And the last two or so years have been 2.5 years, I guess, have been spent working with a lot of SMS families. So I've enjoyed every minute of that.
All right, thank you guys. So Mallory's going to start us off tonight with reviewing our Hetlios prescribing information, providing you a holistic view of Hetlios more generally. After, I'll discuss available resources to help accessing Hetlios through your insurance plan. And then we'll end with an introduction to case management or patient support resources with Sam. And then again, we'll spend some time at the end to go through questions with you all. We'll use the Q&A portion of this Zoom session to answer your guys' questions. Feel free as we're going through this session here with you tonight to put questions in the Q&A box as we're going. And we look forward to going through those at the end. So with that being said, Mallory, do you want to start us off?
Sure. Perfect. Thanks, Francis. I'm really happy to be meeting with everyone this evening to talk about a treatment for nighttime sleep disturbances in persons with SMS. And it has been a very long and at times a difficult path to get to today, or be able where we can talk about a treatment. I believe some of my colleagues first attended a PRISMS conference back in 2012. And prior to that, there were certainly discussions about whether we had something that might be able to help with sleep disturbances. The research program that we conducted, and not alone, leading to the approval of Hetlios was not an easy path. Some of you on the call who've called in tonight may have been part of that study or know someone who has. It took a real commitment on the part of patients, the individuals with SMS, their families, PRISMS, the larger healthcare community to get us to the point where we were able to have a study completed and eventually get approval by the FDA for Hetlios. But what I'd like to do right now is talk a little bit about some facts around Hetlios. This is information that is described in the Hetlios, we can go back one, that's in the Hetlios prescribing information, or the PI. That's that little piece of paper that's in with your medicines that's probably very tiny print to read. However, you can always download a copy of it on our hetlios.com website, and you can click on the link at the top of the tab. So that's helpful. So all the things I'm talking about today, you'll be able to find. And of course, the information I'm going to share tonight doesn't replace you talking to your healthcare team. They're going to be in the best position to work with you to make those medical decisions. So next slide, Francis, let's talk a little bit about. So you may have been wondering, what is Hetlios exactly, or tasimelteon? The brand name of Hetlios, tasimelteon is the active ingredient, and you might be wondering how it works. I will start off by telling you that tasimelteon is what's known as a melatonin agonist, and that really means it activates melatonin and 1 and 2 receptors, and MT stands for melatonin in the brain. The exact way that it leads to symptom improvement is unclear. However, we do know that MT1 and MT2 receptors are thought to be involved in the control of circadian rhythms. Those daily rhythms, which sleep and wakefulness is one example of. Hetlios has FDA approval for 2 uses or indications, and why don't I go over those with you now? Next slide. So Hetlios capsules, and there's a picture of a bottle with a capsule on the left, are FDA approved for the treatment of non-24, which is a circadian rhythm disorder in adults, and for nighttime sleep disturbances in SMS in patients 16 years of age or older. Hetlios actually has 2 formulations, the capsules that you see here. There's also something known as Hetlios LQ, and we can go to the next slide and I'll show you what that is and tell you about that. Hetlios LQ is an oral suspension, a liquid, and is indicated for the treatment of nighttime sleep disturbances in pediatric patients between the ages of 3 and 15 years of age. Between 3 and 15. So go ahead and show me the next slide. So what I want to dive into now is what we call important safety information, the key factors you need to know about Hetlios. So I'll walk you through those now. So one of the first things to keep in mind about Hetlios is that it may cause drowsiness. So after taking Hetlios every evening, patients want to limit their activity to getting ready for bed. Hetlios could potentially make it harder to do those activities that you need full mental alertness. So take your medicine, get ready for bed and go to sleep is kind of what we're getting at with that. It may cause drowsiness, and so to be aware of that. Next slide. So what are the most common side effects? I think that was a question that we hear pretty frequently about Hetlios. And these are the most common adverse events or side effects that occurred more than 5% of the time and twice that of placebo. And there are things like headache, an elevated liver enzyme known as ALT, nightmares or abnormal dreams, and upper respiratory or urinary tract infections. And these side effects may be worse in individuals or maybe more pronounced and frequent in patients who are 65 years of age or older. I will tell you that side effects were similar in patients treated for non-24 and those with SMS treated with nighttime sleep disturbances. Also, side effects were similar in children between the ages of 3 and 15 who received Hetlios LQ, and in patients who were 16 or older and who received Hetlios capsules. So the side effects and the kinds of side effects were similar, regardless of which indication we're talking about. Next slide. Okay, so here's a few more things to keep in mind. One of them is, and I'm sure you all do this, it's something I have to remember when I'm going to my healthcare provider, is tell them all the medications that I'm taking. They have the electronic record, they tell you go through all the medications. It's really important, and for a lot of medications, including Hetlios, because Hetlios should not be taken in combination with certain medications. 2 examples are fluvoxamine and rifampin. Those are 2 medications that should not be taken with Hetlios. It's also important for families to tell the doctor about all health conditions, including those related to pregnancy or breastfeeding. Hetlios has not been studied in individuals who are pregnant. And for non-24 specifically, the safety and effectiveness of Hetlios has not been established in children. So Hetlios is approved for use in adults that have non-24. In the Hetlios LQ, that oral suspension I was talking about, the safety and effectiveness in the treatment of nighttime sleep disturbances has been established for children ages 3 years and above. We haven't studied it in children younger than 3. Hetlios is not recommended for patients with severe liver problems. Again, it hasn't been studied in that patient group, and so it's not recommended for those patients. So why don't I share a few websites and some numbers for reporting any of those side effects that we just talked about. That's really important that we keep track of patients and their side effects. There's a couple of different ways that you can do that. Unfortunately, these numbers and the FDA website are in that prescribing information. You can also reach out to Vanda to report those, or even if you want more information, you can always ask your healthcare provider. Francis, you're going to talk, I think, about some ways to get in contact with us, but also in the prescribing information is the number 1-844-HETLIOS. So you can always, call with whatever your question is. Of course, as I already mentioned, your healthcare team are the ones that are going to give you the specific advice that you need for your certain individual situation. And there's also a way that you can get an accessible PDF if you would like to do that as well. So next slide. I want to close as we kind of get through talking about the basics of Hetlios, some information about administering Hetlios. These are some things to keep in mind. I've already mentioned drowsiness to you. Patients should also be taking Hetlios 1 hour before bedtime and doing this at the same time every night. If one evening your child's not able to take the medication around the same time, they should skip it that night and the next night pick back up with it. So the goal is to take it about the same time every night. Patients should take Hetlios without food, and the Hetlios capsule should be swallowed whole. They shouldn't be opened. For the Hetlios LQ oral suspension, there are a few specific instructions. You need to shake the bottle, for example, and you need to refrigerate it after each use. And once opened, the bottle needs to be discarded after 5 or 8 weeks, depending on the size of bottle that you get. One of the recommendations is when you open the bottle to write the date that you've opened it on the label, for example. Fortunately, there is a instructions for use guide that comes with the medication. So it'll tell you basically how to get everything set up with the bottle and remind you about how long you keep it and keeping it in the fridge and stuff like that. So those are really just a few of the high-level basic information about Hetlios and the safety of Hetlios. I hope that you all found it helpful. I hope that's going to generate some questions, and we'll be sure to talk to those at the end of our time together. So Frances, I will turn it back over to you.
All right, thank you, Mallory. So what we're going to talk about next are resources and support programs available to help you navigating accessing Hetlios through your insurance plan, providing you the information you need to take these next steps. So where it all begins is what's called our Hetlios Solutions program. Hetlios Solutions was created to support people who have been diagnosed with 2 separate indications. So first, Mallory pointed out non-24-hour sleep-wake disorder, or non-24, and patients diagnosed with nighttime sleep disturbances and SMS. This program can assist with coordinating answers to insurance questions, as well as provide financial support and educational resources. So what we'll go over together in the next few slides is the Hetlios Solutions Prescription and Services Request Form, which is what you're seeing here to the left, followed by next steps. What can you expect after you and your healthcare provider submit this form? And then resources and programs along the way to help support this journey. So to start, Hetlios Solutions support will start once you've submitted this prescription and services request form. You see that there's 2 general sections to this form, a top orange section and a bottom purple section. So the top 3 orange sections are for patient or parent information, and the bottom 3 sections are for your child's prescribing healthcare provider. Once this form is completed, faxed in, you'll receive a phone call from a case manager like Sam, who will be your direct point of contact for information regarding Hetlios and understanding your insurance benefits. What our case management team will do is they'll review your insurance coverage with you. They'll determine whether any co-payments or deductibles may be required. We'll check to see if your insurance requires what's called prior authorization for Hetlios. We find many of our patients do require prior authorization. And lastly, of course, your case manager will offer themselves as your continued point of contact for status updates and questions along the way. So I did mention a lot of our patients do require prior authorization for Hetlios. With your consent, our team will also interact directly with your insurance around activities such as preparing prior authorizations, appeals, and also receiving information back from your insurance company. This might be letters of approval or denial. But again, your case manager is your continued point of contact throughout this process. So they're there to answer questions, give you status updates, and really help you throughout this journey. Okay, so while we're working with your insurance plan, it's important to note that financial assistance programs are available to help cover the costs of treatment. If you don't currently have insurance coverage, or maybe you're underinsured, your case manager will help by seeking alternative coverage or financial support. And depending on the situation, eligibility for different programs might be based on certain income or insurance criteria. However, I'm happy to say eligible patients may receive therapy at with Hetlios at little or no cost to them. All right. So lastly, Hetlios, branded Hetlios is only available through specialty pharmacies, and these specialty pharmacies will distribute the medication directly to your home. At your direction, your case manager will continue to follow your progress, and they'll do this by coordinating with your specialty pharmacy to help you start therapy with Hetlios. Checking to see if you have any questions before starting therapy, making sure you get refill reminders as you continue therapy, and as well ensuring that you and your child's healthcare provider have all the necessary product information, such as what Mallory was reviewing with us earlier about Hetlios as you start and stay on Hetlios therapy. So to summarize, insurance support with the Hetlios Solutions program starts with submission of this prescription and services request form. You can download this form and the Hetlios prescribing information that Mallory reviewed with us today at hetlios.com. So we're going to pause here because I know both Mallory and myself have gone over a lot of information with you guys in seemingly a short amount of time. And we want to acknowledge that when considering any new treatment, each patient is unique, and so is their journey. On Smith-Magenis.info and Hetlios.com, you'll find a wealth of information about SMS, genetics testing, Hetlios, and more. You'll also find opportunities to connect with one of our case managers, like Sam here with us, by phone before even deciding to submit a prescription and services request form. Our team works directly to educate you and support your family's unique journey. So again, our senior case manager, Sam Nash, is here with us to introduce and provide a little bit more background on our case management team. And Sam, I'll let you take it from here.
Thanks, Frances, for going through that, and Mallory as well. So as I mentioned earlier, I am one of the case managers. So I work directly with the patients and families. However, the case management role is kind of twofold because in addition to working with patients, we do a lot of coordinating with others to facilitate a smooth process. And so on a daily basis, I might speak with several patients, a specialty pharmacy, a doctor's office, as well as an account manager or two account managers. The account managers are the ones that work directly with doctors' offices and provide information on SMS and Hetlios. So together as a team, a case manager and an account manager can really help with communicating with doctors' offices. They can help with prescribing processes or simply providing information on Hetlios. So I just wanted to highlight that piece of our program because that can be a really helpful resource with the account managers. The primary role of the case management team is really to help you through the entire process, as much or as little as you need. We're a team of 12 case managers with various backgrounds in the health and sciences field. And we spend every day working with families like you all. We really do our best to make sure that you're getting what you're looking for out of our program, whether that be just learning more about Hetlios or sharing information with your doctor or your child's doctor. And we know this is a lot of information, so we do our best to break the process down into more digestible pieces. Try to take a lot of the work off of your plate. We're here to help, and we look forward to speaking with many of you. You know, some of you I may have already spoken with, and so I look forward to continuing that relationship. And I'll go ahead and pass things back over to Frances, who was going to wrap things up and then provide some time for questions. So thanks, everybody, and thanks again for having us.
Thank you, Sam. So now that we've reviewed Hetlios, our insurance process, and our patient support through the case management team, I'll turn it back over to Allison before we flip it over to questions.
Thank you. Thanks, Frances. And thanks to all of you for all the work that you've done to help get this medication approved and for Smith-Magenis syndrome, and taking the time to share all this great information with the SMS community. We really appreciate it. Before we move on to the question and answer portion of our webinar, I would like to introduce you to Tim and Adrienne Hibbs. They're parents of Anderson, and they've put together a great little video for us to watch tonight.
we're Tim and Adrian Hibbs, and we live in Texas. And we have Anderson Hibbs, who just turned 6 and was diagnosed with Smith-Magenis syndrome in 2018 at 20 months old. And upon diagnosis, we were plugged into PRISMS immediately, and we're very fortunate and got to meet some of the PRISMS folks within the first 30 days of the diagnosis. And that was just a huge impact for us, because we were going down the rabbit hole of Googling and reading and wondering and all the what ifs. And so just getting to meet people who had been walking this journey for a long time was such a calming influence for us.
Yeah, I agree. Just meeting people right away, having resources that weren't just the internet right away with PRISMS was fantastic. And I think, too, it's just been such a great support community for us. And the research involved. Anderson has tons of doctors and specialists who have never even heard of Smith-Magenis syndrome. So having a community of people that are dealing with this on a daily basis, like you said, just kind of provides comfort that other people know what we're dealing with. And then also just having that community for support has been awesome for us.
Thank you so much, Tim and Adrian, for putting that little video together for us. We appreciate it. And now we have some time for Q&A, the Q&A portion of our webinar. Our speakers are going to answer as many questions as they can get to tonight. I know we have several, so we might not get to all of them. And I will turn it back over to you, Frances.
Thank you so much, Allison. And thank you all again for your attention during our presentation. It looks like we've gotten quite a few questions. We look forward to answering them. Let's start with, this is something that we spoke to, but Mallory might be a good thing to highlight again. It's around side effects. So when we talk about side effects, could you maybe reiterate the most common side effects? And if there are any side effects that are more common maybe than others?
Sure, absolutely. And we just were talking in generalities, and the rates, I guess, would be something that people might be interested in hearing about too. The general rates of side effects were low. I can give you some specific numbers kind of for some comparison. For example, headache. In the patients receiving Hetlios, 17% did experience headache versus 7% in the placebo group. So that would be, I think that was the highest rate. The increase in ALT, which I mentioned was another side effect, that's the liver enzyme. 10% of patients in the Hetlios study experienced that side effect versus 5% in the placebo group. The people who didn't receive any active medication, those nightmares or abnormal dreams, I think up to 10% of patients receiving Hetlios versus 0% in patients that were receiving placebo. And then with regard to the upper respiratory and urinary tract infections, it was about 7% for both in the Hetlios treated group, and I believe that there were none in the placebo group, 0%, and there was 2% that had placebo patients that had urinary tract infections. So, and I did see another question about kind of like the serious adverse events or serious side effects, and that specifically with the sleep disturbances, nighttime sleep disturbances in the SMS trial, there were no reports of serious adverse events, and that's kind of ones that might require a specific intervention or hospitalization or something of that nature. Great question to ask. Like, it's one thing to say common, but to just figure out like how common, right?
Great, that's a good one to start us off with. It looks like we had another question about coverage with Medicare and Medicaid. Does Medicare and Medicaid cover Hetlios? So this is another really good question, and I'm glad we have this question here because I think it's important to note that coverage within different plans do vary. However, with the submission of our form, we do find coverage with commercial, Medicaid, and Medicare plans. And you're based off of your specific plan. Your case manager can go over the benefit investigation with you to take a look at what your coverage looks like, maybe go over the formulary with you if there's anything such as genetic testing is something that might be common, step therapy, things like that. So there are varying levels within each, but we do find coverage within Medicare and Medicaid to answer that question. It's a really good one to start us off with. Another question for you, Mallory, might be in regards to drug interactions. So you did speak about drug interactions a little bit. We have a question about a specific medication, but maybe reiterating any medications that a patient might want to talk with their healthcare provider about before starting therapy. This question is specific to Zoloft, but anything maybe you're able to speak to around that.
Yeah, and so probably the best resource for specific medications, because there are a lot of them out there, would be someone with a healthcare team, a pharmacist or a physician, to get those specific questions, because there's dosage and how things are administered and stuff. But I do want to point out that the prescribing information does describe possible interactions with a few medications or groups of classes, they call them, of medications. So I mentioned one of them, Hetlios, should not be taken in combination with a medicine called fluvoxamine. And it's metabolized in a certain way by the liver. It's called a strong 1A2 inhibitor. So other medications that are strong 1A2 inhibitors could potentially have kind of some of the same effects. And another one is called rifampin, and that's another medication that can interact with Hetlios. So drugs that are metabolized like fluvoxamine may lead to having more Hetlios in the bloodstream, and that could result in more side effects. And then with a drug like rifampin, that could lead to a decrease in levels of Hetlios and decrease effectiveness. So it's definitely important to talk to your treatment team about any medications, even if they're not the ones writing the medication, right? Even if another healthcare provider has written the prescription. Also, one other thing I did want to point out is that beta blockers, or it's kind of like acebutolol or metoprolol, administered at night may reduce the efficacy of Hetlios. So that's also in our prescribing information, and that's used at night. Yeah.
That's a good. I think that covers it well, Mallory. Thank you so much.
Okay, great.
We have another question, which is another good one. So can any of your child's doctors submit the prescription and services request form? Can it be a primary care physician, or should it be a neurologist or another healthcare provider? So we can advise, of course, who should fill out the form if that's something that you and your doctor agree to move forward with. However, I would say whoever you're most comfortable with. The form can be, we'll take the form from any healthcare provider who is able to prescribe. So whoever you're most comfortable with, whomever may have the best understanding of your child and your child's medical history, will be able to process the form just the same. So any prescribing healthcare provider can submit this prescription and services request form. Mallory, there's a question about kind of quantity and quality of sleep. So how many hours can you expect an adult child to sleep without waking? I know that there's some numbers that we might be able to point to in our clinical trial. Is this something you might be able to speak to?
Sure. I think I guess one of the things to point out is this is a group, this is a study, this looks at averages. And so you can't really say specifically which on a certain individual, how many hours they're going to get more asleep or not. I think for what to expect with Hetlios, again, I think that's a question for the treatment team or the healthcare provider to give you an idea of what they would expect in your person's given situation. We did see an improvement in our clinical trial in terms of in two areas. One, something called sleep quality. So this is a parent or caregiver rated scale on what they thought that quality was like for the individual who was part of the study. And then we also looked at total sleep time. So, and we look at these on a 50% of worst nights. We know that with our understanding is that with sleep disturbances and SMS, there's some better nights and then there's some worse nights. So we wanted to see about the improvement on sleep quality and sleep time on those worst nights. As expected, or as we're hoping to see, right, that it would be beneficial. There was an improvement, a statistically significant improvement in individual sleep quality over the study. And it was a crossover study. So it was 4 weeks of treatment and then a week where you didn't get any medication, and then 4 more weeks of placebo, or vice versa. Maybe you got placebo for 4 weeks and then you followed with 4 weeks of treatment. So it's a relatively short study, but we did see sleep quality improvement. We saw improvements in total sleep time as well, and that was numerically, but it didn't reach statistical significance. So we did see an improvement in that. Not everyone is going to respond, and some people are going to have a better outcome than others. That's part of the individual differences for patients. So I don't know, hopefully that would be helping. I wish I could say specifically, right? We all would love to know that, right? Specifically, what is going to be the impact for my child on, exactly how many hours that they were going to, minutes or hours that their sleep would improve.
That's really good, Mallory. And I think that's helpful context for us all to consider, especially when we're considering, our unique family's needs. So thank you for that. The next question is about access. So I'm seeing someone who's looking to fill the prescription through a pharmacy and isn't able to fill it. Any suggestions? So if you haven't already, my suggestion would, of course, go back to the prescription and services request form. This is because we work with a network of specialty pharmacies. I'm curious and I'm wondering if you might be trying to fill at a pharmacy that's not one of these specialty pharmacies that distributes branded Hetlios. So if you haven't already, certainly submit this prescription and services request form. If you need help with that, I'll bring back the QR code that you were seeing earlier, and you can connect with a case manager before submitting this form to discuss the form a little bit more in detail together. Maybe get some help getting this form over to your child's healthcare provider. And we could talk a little bit more about our network of specialty pharmacies and make sure you're going to the right place. So I'm glad I saw that question because that's another good one. We're getting a lot of really good questions. So Mallory, I think the next one, I'm going to go back and forth a little bit. It's in regards to melatonin. So I know you mentioned Hetlios is a melatonin receptor agonist. Can you maybe expand on the difference between Hetlios and the over-the-counter melatonin that a family might pick up?
Sure. Yeah. So you're correct that both melatonin, the supplement, and tasomelatin or Hetlios, the medication, both work or are believed to work at melatonin receptors. However, they're distinct medications. They aren't the same. They have some different characteristics and properties between the two. They have not been studied comparatively, so there's not been a trial where it's been tasomelatin versus melatonin to see which one works better. They also haven't been studied in conjunction where both medications were taken together. Hetlios is a medication approved by the FDA and has that approval, and so there is that difference in a supplement versus the larger scale studies that have been completed, the SMS trial, the Nighttime Sleep Disturbances trial in individuals with SMS. I'm not quite sure if we haven't studied them against each other or together to see in terms of outcomes on symptoms and things.
No, I think that's really good, and definitely important to clarify the difference between the two. I'm seeing another really good question, Mallory, and this one is another one we might be able to clarify a little bit more, and it's in regards to administering Hetlios with food. So you talked about administering Hetlios with food or without food, and the question is in regards to how close after eating. And it's actually the question is, does it undermine effectiveness entirely, or does it just reduce efficacy? Can you maybe expand on that a little bit more?
Sure. And that's a question we do get asked pretty frequently. It's because I say this as part of the presentation, do not take with food. And sometimes dinner is awfully close to bedtime or that hour before bedtime. So it's a really a reasonable question to be asking about. So what we did was, or what the FDA asked us to do, was to administer Hetlios with a high-fat meal. That's just part of the testing that's done. And so when we did that testing, we found that the time it took to get to peak concentration in the bloodstream took longer, and that the amount of tasmaltein dropped by 40 some odd %. So I think the question was about, does that potentially decrease efficacy, right? And it could. That could happen. We don't know. We'll never really be able to test like specific specific foods or exactly the time. And this was studied when they were taken at the same time. With the meal, you're taking the medication. So I think as parents, you want to do the best that you can, right, to get the medication so they can have enough of a blood level or enough tasmaltein in the body to have that efficacious or to have that efficacy. But we all live in the real world too. So I think if you do have a plan for how you can best get the medication dosed around meals, talk about that plan with your healthcare provider. Have a way to look at outcomes as a result of that plan that you're using. Certainly, if you can take it without food, if you can take it, every night, those are all things that to maximize the ability for it to have to be efficacious.
That's great. And it looks like we're slowing down on questions, so I actually have a last one for you, Mallory, and then I'll pull up the QR code again for additional resources. And this last question actually is in regards to accessing Hetlios abroad. This individual is not in the United States and is wondering about if they are able to access Hetlios in another country and what that might look like. Is there additional research that'll be done there?
So the approval for Hetlios for the treatment of nighttime sleep disturbances and SMS is only in the United States currently. Healthcare providers that have questions about getting access to Hetlios in other countries, I can't remember the exact spot on our corporate website, but they could go to our corporate website where we have a patient access program and get more information on that. I don't have any other details right now about obtaining Hetlios in countries other than the United States.
I think that was important to highlight, because I'm not sure if we clarified initially that it is approved in the United States. If you go to vandapharma.com, you'll find information for accessing or requesting information about accessing Hetlios abroad. So I'm glad we talked through that a little bit more together. So we reached the end of our questions. We had a lot of really good ones. So we really appreciate all of your guys' attention and your questions throughout. I think this really provided a really good overview of Hetlios for nighttime sleep disturbances and SMS, access through your insurance plan, and a little bit more about our case management team. If you'd like to connect with a case manager one-on-one directly to chat more, you can use this QR code that you're seeing here to register for additional information. And on behalf of Mallory, myself, and Sam, we'd like to thank you so much for joining us tonight. Thank you, Allison. Turn it back over to you.
Thank you so much. We really appreciate you guys being here with us this evening. This was all really great information. I hope everybody learned as much as I did this evening. And thanks to everyone in the audience for joining us and for all the great questions. So I hope to see all of you on future PRISMS webinars. Please make sure to subscribe to our YouTube channel. That's where you'll find all of our webinars, and make sure to follow us on social media and to join PRISMS if you're not already a member. Membership is free and it's the best way to stay up to date with all things SMS. PRISMS is a nonprofit organization. All of our programs, including our webinar series, are fully funded by your generous donations. So if you're interested in supporting PRISMS and the programs that it provides families impacted by Smith-Magenis syndrome, please visit our website, prisms.org, and consider making a donation. So this concludes our webinar, and I hope everyone has a great evening and good night.